Yo, what's up, everybody? Welcome back to the channel. Sorry if it has been like a long time since I last uploaded. I was busy doing a lot of things like math problems, you guys know. So, today we're going to be presenting to you Heart Failure Overview Part 2. And in this video, we're mainly going to be talking about the diagnosis of heart failure, treatment and prevention, and risk factors, those are going to be for part 3. So, anyway, let's get in. Well, last episode we said that remember how heart failure has 4 types: left, right, diastolic, and systolic? Well, we said that we'll cover systolic and diastolic heart failure in later videos, and we're going to cover them today or in this video. So, first of all, what is systolic heart failure? So basically, the heart wall dilates and enlarges like a balloon, causing it to be too weak to pump blood. So basically, what this basically means is that systolic means systole, which is basically the contraction of the ventricles as they send blood throughout your lungs or throughout your body. And systolic heart failure means that your ventricles can't send blood. There's an issue with sending blood to the rest of the body as the ventricles contract. Well, diastolic, on the other hand, basically the heart wall is aka too massive and thick and stiff to be able to relax and fill with enough blood. This can be known as hypertrophy, or basically thickening of the heart muscle. Sometimes it can be near the intraventricular septum right here, or it can just be near the apex of the heart. So anyway, there's thickening of the heart muscle. The heart muscle looks different under a microscope because of all that thickening, and in turn, the heart is unable to relax with enough blood. And this is what diastole means. Diastole literally means the ventricles that relax with blood, while the atria pump blood toward the ventricles. But obviously, there's a problem with this diastole, which causes the heart muscle to be unable to fill with enough blood in order to eject that amount of blood to the rest of the body, resulting in heart failure. So anyway, if any of these 2 types occur, they all result in less cardiac output and something we call stroke volume. So but before we do that, we're first gonna talk about like a few kind of diagnostics of like heart failure. So an overview of these diagnostic methods include ECG, which is basically monitors the electrical rhythm of the heart, making sure that your rhythm of the heart is proper. If you have anything that is wrong with your rhythm, as we said in the last video, known as arrhythmia, then that basically just means that your heart rhythm is off, and that can lead to heart failure. Or it can also detect hypertrophy or thickening of the ventricular walls. So that is also something to note right there. Echocardiogram. This is one of the more main diagnostic factors. Echocardiogram basically uses, well, we're going to talk about it later, but basically just uses like ultrasound and just uses sound waves to detect all of that stuff. And then chest x-ray is basically when you take a chest x-ray. It's pretty straightforward. What you can detect is that in your chest or in your are basically your lungs and your heart. It can detect fluid buildup, which is known as pulmonary edema, which is a common sign of left-sided heart failure in the lungs. Or you can just check for enlargement of the heart, which can be a sign of hypertrophy slash uh, dilated cardiomyopathy, or the heart muscle being enlarged and just dilated. And finally, we have blood tests. Well, this matters because sometimes, like Some blood markers may be high when the heart is like stressed and weak. And also, if you have a heart attack, blood tests may help because they can detect something called troponin, which basically happens when your heart muscle breaks down. And that can be a sign of dying heart muscle, and that can be a sign of heart attack. And so now here's one key aspect of diagnosing heart failure. This is something known as ejection fraction. So what is ejection fraction? Well, it's basically the amount of blood, the fraction of blood the heart ejects compared to the blood that it is filled with. Ejection fraction is another crucial aspect in determining heart failure because it often separates systolic and diastolic heart failure, which are two different mechanisms of heart failure. So let's see how the heart really works when it contracts blood. So sorry if this is like a lot of vocab, but I'll quickly explain everything. So what's the end diastolic volume? So the end diastolic volume is basically EDV is basically how much blood the heart fills up with to the end of diastole, or just how much blood the heart fills up with before it contracts. So this can just if the heart is unable to relax properly, it can result in less end diastolic volume because it's unable to fill with blood fully. And we also have something related to EDV known as preload. Preload is basically the maximum stretch of the ventricular wall. So you see, as the ventricle needs to stretch in order to fill up all that blood, if it can't stretch or its preload is it doesn't its preload is not that good, then that means that it may not be able to relax with enough blood. And then we have something called the end systolic volume. And I'll quickly, yeah, wait, let's just erase this whole thing. So what's the end systolic volume then? That is supposed to be, you see, the heart ejects blood throughout the aorta. By the way, ejection fraction is mainly talking about the left ventricle, so that's why I'm just using the left ventricle in this case. And after it ejects blood throughout the aorta to the rest of the body, the left ventricle is left with a certain amount of blood. This is important to know as the heart does not eject all the blood in one fellow swoop. It has some remaining. That's just its mechanism. And it has some blood left still in the ventricle. That is known as the end systolic volume, or ESV. Please don't mind the ugly handwriting. So basically, that's the amount of blood the heart is filled up after contraction. And now here is something that is also related to ESV, or end systolic volume, and that is called vascular or resistance or afterload. Basically, in this case, if the heart has to pump blood, it has to this is how it pumps blood, really. So there's a pressure gradient. Let's say there's a pressure gradient in the aorta, right? Well, in order to pump blood, the left ventricle has to generate a pressure gradient greater than that of the aorta in order to open the aortic valve and send blood through the aorta. This is like just common like physics knowledge, really. So if it has a greater pressure, blood flows from an area of high pressure to low pressure like most other fluids. So and then that causes the opening of the aortic valve and blood flowing to the body. Some things that can restrict this is obviously the weakening of the heart muscle, which causes it to be too thin and just dilate. Or it could just be that the heart valve doesn't open properly. It may be stenotic, or it won't open when the pressure gradient is higher. That requires the left ventricle to generate even more pressure in order to make sure it forces the valve open. And that is also something that is related to heart failure. And now we finally move on to some of the more important stuff. Like, these are all important, but this is what ejection fraction actually means. Let me just erase like this stuff. Yeah. And here, let's say the stroke volume is supposed to equal to, well, the end diastolic volume subtracted by the end systolic volume. So it's the EDV minus the ESV, which makes perfect sense, as the blood that, first of all, the heart is filled up with that much blood, and we also have the heart that is, well, has gotten rid of some blood and is still left with some blood, and that is known as ESV and systolic volume. And if we minus that, we'll basically get how much blood the heart has pumped out. So, with that being said, that is the stroke volume. It's basically how much blood the heart ejects with each beat. And now, quick note here: cardiac output, which I cannot, which, yeah, don't mind my handwriting. Cardiac output is basically equal to the number of beats per minute times the stroke volume. So that should be equal to beats per minute times the stroke volume, or basically how much blood the heart ejects within 1 minute. And that's something to note as well. And now we are finally here with ejection fraction. Ejection fraction is basically, what it's defined is the stroke volume divided by the end diastolic volume as a percentage, which is pretty understandable. If we learned in math, we learned about something called percent change, right? Wait. Something called percent change. Wait, what? Okay, so, and when we calculate percent change, we do this. We do the final result minus the original and divided by the original equals 2% over 100. This is what we do. It's basically the final end diastolic volume, end systolic volume. Oh, sorry, this is supposed to be like, wait, yeah, so that's the stroke volume. Never mind. So it's basically the end diastolic volume subtracted by the end systolic volume divided by the end diastolic volume. So that basically just means how much of the blood, the stroke volume, which is basically this, divided by the end diastolic volume. And that should equal to a percent. So basically, what fraction the heart of the blood, the what fraction of the blood that the heart ejects compared to when how many blood it is when it's filled in, like, yeah, what fraction of blood the heart ejects from the amount it is filled in with. And that is basically ejection fraction. And now, after we know like what ejection fraction really is, what's the importance of ejection fraction? Well, you see, in diastolic heart failure, the heart can't relax with enough blood, right? So that results in a low end diastolic amount. But then, okay, that's so basically that means we have a smaller denominator, because since ejection fraction is essentially stroke volume divided by end diastolic volume. So that means we have a smaller denominator. And how about our stroke volume? Our stroke volume could be the same. Again, it also could be smaller, But overall, because the main thing it affects is the end diastolic volume, or the denominator, becoming smaller, while the heart's ability to pump blood is still not that impaired. So basically, our ejection fraction may have this becomes smaller. This may become just a slightly smaller. So it may be relatively consistent with your normal ejection fraction, and that is something called preserved ejection fraction heart failure. So that is basically diastolic heart failure in this case. And in systolic heart failure, however, the heart's ability to pump blood is reduced. So that means our stroke volume right here would definitely go down a lot. But our diastolic volume, not so much, you see, because the heart's ability to fill with blood won't really go down. So just a teeny bit, or sometimes it may even go up because the heart is enlarged. So this if you have a small numerator and definitely a greater denominator, then the chances are you're going to get a smaller fraction. So that basically just means a less ejection fraction compared to normal people. So that is known as reduced ejection fraction heart failure. And also, quickly to note, the ejection fraction of heart failure patients is usually, well, yeah, with non preserved, just reduced ejection fraction. So that should be smaller than 40%. And now we're going to mainly just talk about the treatment of heart failure. I mean, the diagnosis of heart failure. So, our first method is called echocardiogram. It's one of the most best diagnostic methods, as it is able, again, it's sending ultrasound waves through the chest and into your heart. And as they bounce back, a probe is recording them, which basically reflects on all of these heart chambers right here. So this is, I suspect, like, you can find like the atria right here, or the and the ventricles right here. Not only that, you also have this. Basically, what is this thing? Well, that is the turbulence of blood flow. That can be very important in determining the blood flow through the heart, whether it's like harder for the heart to pump blood, then that would be more resistance. And that can also indicate valvular disease. Not only that, it can also indicate the thickening of the chambers of the heart and the enlargement. So that is able to diagnose like diastolic from systolic heart failure. And now we also have the another type is, again, we have the ECG, which is electrocardiogram. And again, this one is known as detecting heart rhythms, but it can also be known to determine thickening of the ventricles, as they cause basically voltage changes inside the ECG. Basically, the ventricle may pump like may have a more forceful contraction and thus result in a higher voltage wave. So you see, like, just quickly talking, what are the criteria for right and left ventricular hypertrophy and heart failure? Like, yeah, and just the ECG. Well, for right ventricular hypertrophy, we have like the voltage here should be highly positive and leads in this V1 and V2, or else, yeah, just the R wave is greater than S wave, if you know what I'm talking about. And for left ventricular hypertrophy, let's say in leads V5 and V6, this should be greater than 35. So that should be greater than 55 millimeters as a measurement. So this voltage right here. And one small box is 1 millimeter. So yeah, I guess that's it for today's video, as I just mainly talked about the treatment options of heart failure. Again, uh, my content is not really like, I'm definitely not a medical professional. I'm just mainly learning about these things and just like it's also practice for me when I share like my insights about this topic. So thank you guys all for watching. It's like very appreciative of you guys. So yeah, I guess I'll end the episode off here.